Yeah. I was going to say, well,
Pistachio, okay.
if you, after this, are you going to just stay around?
Yes.
Okay. Can I just like send students your way and just have them on you? Yeah. This is the day also where there's like presentations for the Science 101 course and stress and busy, so I'm going to give them the option to.
Well, of course. Yeah, absolutely, yeah.
And usually start. And what I'll do during Q&As, I'll check this and I'll go on mute.
Yeah. Yeah, so maybe like even like yeah. Do you prefer the Q&A like during the talk or just at the end to make it easier for the Zoom? Okay. Okay.
I think it's easier. If somebody has any clarifying questions.
Yeah, because I decided to present. I have like two main like big projects. So I was thinking to have at the end of each, to have like, Yeah, but the open space is amazing. Yeah. Have you ever been in ICI in Turin? Okay.
Yeah. We did that big trip last summer, I think. A lot of the mobs that went to ISI.
Okay. Because this is like way bigger, but like the idea, like the structure, like it's similar. Remind me when I did my master thesis. Yeah, like yes, I did my master with Vittoria Colizza. It was at that time was affiliated with ICI, and I've never been introduced to Alex in person. Of course,
well, sadly, that's not gonna happen this time. That's just off somewhere. We'll zoom in tomorrow for some of the. You two know each other, right?
We just exactly. It's not the same. Yeah, we know each other. Yeah, I know everything about the work, but like we never met, like never presented officially. Yes. Yeah.
You met Alessandra?
Neither, like no.
This is like blowing my mind social network wise.
Yeah, yes, why is possible? Exactly. Yeah. Yeah, because they're doing conference, you tend to interact with people that you're already.
Okay, let's go now. So, thank you all for coming. Thank you especially to students in network science who have good presentations tonight and are not right now. So, really appreciate that. And I really want to welcome Giulia Pullano, who's visiting us, I think, for the first time at the Science Institute. And we're from Georgetown, where she's currently a postdoc, but before that, he worked a lot with Vittoria Colizza. And so many of us probably know of her, and I'm just realizing now that not many of us know her. So she'll be here throughout the afternoon, and then for those of us participating in the collaborathon this week, she'll be around that. So if you like what you see here, there's lots of places to ask questions and just interact. But otherwise, thank you for coming and take it away.
Thank you for the introduction and thank you for inviting me. Yes, as Brendan said, I'm a postdoc fellow at Georgetown University. My main interest is understanding human behavior and track human behavior through mobility data and for mathematical modeling for disease prevention and control. And so that's what I'm going to talk today. I will give you a couple of examples of my work. Before, I want just to introduce my custom lab, like at Georgetown, like I work in Bansal Lab with Giulia Bansal. And of course, as Brendan said, Vittoria Colizza was my PhD supervisor and my current collaborator. We also work with that data provider that provide us like mobility data, mainly in the US with SafeGraph, and Orange in France, that is a network operator, the main network operator in France. And like they will like give us the data that we use in our studies. So why we care about mobility data, why we need mobility data. So maybe most of you know better than me about that, but the point that like moving and like mixing like in a environment, we alter our probability to get in contact with people, and so we alter the probability to be exposed to pathogens, and so to get infected. And this can happen on different scales, as you can see here. That's like locally, but at the same time, people may move like farther away and then move in places where there are no epidemics and import new pathogens, as you can see here. Or another example of mobility is when you have like two places with outbreaks going on, and they like you have like mobility fluxes between those locations, and so you create a couple effect of epidemics where you synchronize this viral diffusion. So all these aspects need to be taken into account when we think about the coupling effect between human mobility and epidemics, and when we want to model this complex system. So, but that's not only the issue. Like everything is more, let's say, that's an extra layer of complexity that mobility may change. And what we know here, like we have an example, for instance, during the in Singapore during the SARS, that people stopped visiting because they were afraid to get infected. So we see a drop in the visitors by air traffic. Or another example is like mobility may change due to restrictions. So for containment, like that's the example of like the Ebola outbreak in 2014, when we observed like was 3 days lockdown. So we observed a drop in the daily movement in Sierra Leone in this specific place. And then, of course, a more recent example that everyone experienced was during the COVID pandemic, that we observed changes in mobility due to the containment, local lockdown, so national lockdown, plus the adaptive behavior. So like adherence on isolation. And for instance, this is a work that we did in France early on, where we observed the mobility reductions during lockdowns, and but the reduction were heterogeneous across regions. Indeed, we found that the region most affected, so with high number of hospitalization, there were also the one with like higher reduction in mobility, telling us that like the risk aversion, so people they were living in location more affected, they were also more scared, so more compliant to the lockdown. So all these aspects need to be considered when we want to integrate mobility into the model. And that's the reason why mobile phone data are extremely powerful nowadays, because they can help us to track mobility in real time. Mobile phone data have been used by researchers like in the last decade in multiple countries and for different applications, not only for public health, as you can see here in the maps, but of course was during the pandemic that researchers asked to like immediate share of like mobility data to help fight the pandemic, to track human mobility and help reduce the COVID viral circulation. And it was at that moment in the last years that multiple private companies like Google, Facebook, SafeGraph in US, Apple, and also network operators like Orange in France, the example of Vodafone in Italy, and they all share their data through like weekly reports, so aggregated form of their data to help us researchers to be able to track mobility and use it for public health policies. So how we use this mobility data and how we integrate in the model what we do with that. So I listed here like the 5 reasons that like mobility data matter, like, and to be integrated into model and what we do for what we do there. First of all, for like evaluation of control policies and surveillance efforts. Then you can use like model to do like scenario analysis, prediction, forecasting, parameter estimations, or also you can use like modeling to have like insight of the key mechanism of the disease diffusion. So what I want to talk with you today, that today's agenda is 2 of the studies that I'm working and worked on. The first one was on the evaluation of the surveillance effort in France during the early stage of the pandemic, when we quantified the underreported cases in exiting of the first national lockdown. And then a second work that is under review now, so like it's most recent, and so it's a retrospective analysis when we try to understand the scale of the mobility that influence the propagation, the diffusion, the geographical diffusion of the COVID-19 in the US in the early stage. So 2 different problems at 2 different scales. The first one is more like local, per region, and the second case study is more national level in the US. So let's start for the first one. So why we care about, do you have like,
Is it a...
because I don't see, yeah. Sorry, this is,
yeah.
Yeah, so that's perfect, okay. So why was it important to quantify the underreporting of cases? This work was performed, as I said, at the end of the first national lockdown in France in 2020. So the government was asking, I need to release the mobility policies. How can I make my testing strategy more, how can I improve it in order to don't create a rebound of cases now that I release the interventions? So they were like trying to change, to improve the testing policy. So what we did was, okay, let's help them try to quantify the detection rate. So that's what we did in the weeks of like May, June 2020. And we quantified the detection rate like nationally and like regionally to understand like the heterogeneity across regions. And to do that, we use an age structure transmission model that was specific for COVID. So that's a classic, like everyone is familiar with compartmental model. Moss, like I can like briefly like describe, but like compartmental model are used to model disease dynamics. So that's specific for COVID. As I said, we have multiple compartments. Each compartment is a health status. So individual may be in one of these of the status, and so they can be susceptible, exposed. So they got infected, but they are in the latency period. Or this is specific for COVID. So we have a prodromic phase, and then like people can get like different like level of symptoms. They can be asymptomatic, or they can develop different degree of symptoms, and to be pouchy symptomatic, mild symptomatic, or severe symptomatics. And then, of course, people that show severe symptoms, they can get like to the hospitalization compartment. This model was specific for each region, and is also depending by age. So it's the age structure. It means that the population is divided like in age classes: young children, adolescents, adults, and seniors. And this is done because like adults that were most affected of like COVID, so we needed to break down by age group. And then like susceptible individual, they can be infected if in contact with someone that is infected through the force of infection. So that's the probability to get infected that depend on the beta, that is the transmissibility rate, specific for COVID. And then you have like I, that is like the number of infected individuals in the model, and then C, that is a contact matrix that is the, let's say, the element in our model where we introduce the mobility data, so the behavioral component. And what we did, like we parameterize the evolving contact rates depending on the situation ongoing in France through parameterizing this contact matrix. And was a very challenging aspect because so far, pre-pandemic, what was common to do with this kind of model was just introduce a contact matrix that was static. As you can see in the baseline, this was for France, was developed by Béraud et al. And is a contact matrix that was from a survey defining the daily contact rates between age groups. And the contact rates were estimated in different locations like household, workplace, school, transport, leisure, and also like other like general like location. And you had two types of contact, physical and non-physical. So all these contacts, they were aggregated like some to create just one like contact matrix. That's the one that then is integrated into the model. So during the lockdown, we said, okay, we cannot trust these metrics anymore because like all our contacts like dropped. Everyone is like literally lockdown, and like specifically in France was very severe. The lockdown that we experienced, no one was able to go out. All the business were closed. Only essential like business were like still open. So we reduced the contact in the contact matrix using the mobility data from Orange in like workplace, transport, and we accordingly increased the contact in the household. And of course, like we set equal to 0 the contact in the school and all the leisure and other activities because they were not possible. But as a second step, after the lockdown, when the intervention like was released, this was the hardest moment to parameterize the contacts because we didn't know what was happening actually. Some schools reopened, some in the most affected regions in France did not. At the same time, business reopened, but most of people still try to work from home remotely. And that was also very heterogeneous by regions. So we really didn't know like how to be able to capture these multiple behaviors. It was at that time that Google started to release some like mobility reports showing mobility trends by region, and that was worldwide and on different type of activities. So as you can see here, there were reports about the reduction in mobility, like weekly, like in workspaces, parks, transit stations. So we use that data to try to capture the changes in the contacts among individuals at different stage. So that's the first information that we use to calibrate our matrices. That is from Google, is the variation of the number of people at workplace. As you can see, the trend is very different across regions. In particular, the Paris region, Île-de-France, experienced a reduction in number of people going to work, like bigger compared to the other one, because there were more people able to work from home. Like, and so we use this reduction to inform our metrics, plus we couple this information with other type of like behavioral data sources that were available at that point. This one is from a survey, is the people avoiding like physical contacts. And this avoidance was decreasing over time, week by week. So we used this information. Also, this was another survey that shows how the seniors like reduce 30% more their contact compared with like younger people because they were like higher risks, also more or less cared about. So we use this information and as well the school data. They're like showing the attendance attendance at school, and it was different region by region. And as you see, the regions colored in red, they were the region that like they didn't open their school after the lockdown because they have so many cases that like for a few weeks after the lockdown in May, June, they were still closed. So we needed to capture also this aspect. So once like we integrate all this information in the contact metrics, we ran our simulation. And the model was fit on the admission in the hospitals. There are the black dots in the plot you see. And we also did a model selection, trying to understand if it was worth it, all the work that we did, trying to parameterize the contact matrices. So we look at the output of a model informing the contact metrics parameterized in real time. And then on the right, you see a second scenario when we ran the simulation with our model using like a baseline contact matrix. So the original was pre-pandemic matrix. And comparing the likelihood of the model, we observe that like the contact pattern over time that we infer with the mobility matrix in real time was better to describe the epidemic trajectory. So like, as a second step, we try to validate our model and use serological data. And we validated both at national and at regional level. So you see how our model predict the percentage of infected population over time, like weekly. And the red dot is like the serological data that we use to validate. And with our model, we are able to capture exactly the data. So once that like we calibrate and validate our model, we trusted to be able to estimate the underreporting. And what we found was that during the period of May, June 2020, only like 90,000 symptomatic cases have been not detected. So the reporting rate at that time was only 10%. As you can observe in the plot, the blue curve is the prediction of our model, is the new symptomatic cases over time, like quickly, and the black dot is the detected cases at that time by the surveillance system, and in red, that's the detection rate that we were able to compute through our model. So it was quite low, but like another thing that we observed, like it was like increasing over time while the symptomatic cases were decreasing. Looking also like at the map here, like the detection rate that was in week 26 at the end of June, you can observe how is heterogeneous across regions, in particular is lower in the region with like the highest number of cases. So we were very intrigued to try to understand what was the relationship between cases and underreporting. So we tried to find some indicator of the detection performance. And the first test that we did, we compared the detection rate with the positivity rate. We did that, as you can see here in the plot on the left, because like the WHO threshold is like 5% of positivity rate to say, okay, that's alarming. And but like we way lower the threshold during like the exiting of the lockdown in France. But however, the detection rate was very low. Indeed, if you look at on the plot on the right, we found a power law relationship between the detection rate and the incidence. And that means that basically the detection capacity like scale as the inverse of the square root of the incidence. And to give you an example, it means that like if you want a detection rate that is like 66%, that is a value that is necessary if you don't have intervention put in place, you need to have an incidence that is lower than 1 per 100,000 cases. A scenario that was like 50 times lower what we had at that moment in France. So it means that like no matter the effort, like in the detection, was like almost impossible to capture enough cases to avoid a rebound. That's what we experienced indeed, like in the summer, like few months after, was a rebound of cases. And so, like, just to like summarize this first project, I really want to, I listed like some take-up message that the first was really, when you work in pandemics, like in real time, the first challenge is really to understand the questions that you need to answer. And that's why you need to work with policymakers and government to understand what is required, what they need to know at that stage. Then another part of this project that was very challenging was the aggregation of multi-source of data, in particular behavioral data, to be able to capture the evolving scenario. And specifically in the context of the contact metrics, parameterized real-time metrics, like we have never done it before, so we really didn't know how to do that. And so we create this sort of like ad hoc parameterization to be able to represent what was going on. And so now, like one ongoing work that like one of my students is doing is try to understand if this power law relationship between incidents and reporting rates is generalizable or was just a contest of friends at the exit of the lockdown. So we are like trying to test this power law relationship across like countries and epidemic phases. And like, I don't know, like I would be happy to answer some questions before they like go through like the second project.
Questions on this first one?
Just about, you mentioned like school attendance rates and mobility data as contact surveys.
Yes.
Combine those all to then change.
Yes. And we combine that. Yes, like I can go back here. So the point that like we had a contact matrix that was pre-COVID. So giving us the contact rates daily in different locations. So what we did was reducing the contacts for instance, in work setting, accordingly with this reduction, like was a 50% of reduction. So according with this value, we reduce the contact at work in our metrics, and also like in transportations. And for instance, like in schools, we use this data to reduce the contact accordingly to the percentage of people like going to school. And then overall, across all the locations, we use like more general information to reduce like contact among seniors, like with like 30% more compared with like the contact between like adolescents or like a child. And this is what we inform this by the people avoiding physical contacts, because in the metrics, in the baseline metrics, you have contact. That was something that I was saying before. You have two types of contact, physical and non-physical. So we were able to reduce the physical contact in the metrics, accounting for the physical contact. Yes.
So this the ongoing work that you have with this parallel relationship, I'm wondering if so like with COVID, there was like a pretty significant asymptomatic transmission rate, and so this contributes to like predictability. And so and obviously that's the person who is a part of it. You do this analysis, but for other types of pathogens like that have varying asymptomatic rates and detection rates to see if that's I don't really know that many factors there, but
yeah, that's interesting. Like in this model, like I didn't mention, like we also compute the detection rate for asymptomatics. So that was specific for symptomatic cases. And we compute the detection rate for asymptomatic, of course, was higher. What we are doing now, like the students, is still for symptomatic cases. Yes, but that would be like interesting to understand like the relationship, because what like for the moment we test just for symptomatic cases.
model continue to fit over like a long period of time, or like will this model start to perform worse at some point?
So no, can you repeat the question?
Will this model continue to perform well for a long range of time? It's like people start to change the behavior of things, like so they're maximum vaccines and stuff.
This model didn't take in account vaccine and other sort of aspect that change later on. But of course, we did other works after this in particular. We had to take in account vaccinations and as well as immunity and all other aspects that were more relevant later on, but not at that stage. What time is that? It's 1:30. That's perfect. So yeah, 30 minutes to the second one. That's beautiful. Okay. Yes, this is another project that I'm working on right now. It's US focused, it's under review, so it's more recent and it's more network based. So maybe it was more for their type of community. And we are in this particular work, we try to understand the mobility aspect that was help us to describe the geographical propagation of early stage of COVID in the US. And to do that, we use the SafeGraph data. There were mobility data available during the pandemic. So download was free from their website. And unfortunately, are not anymore for privacy issues. Everyone just stopped to share their data. We are fighting for that. And so that's what I mean, geographical propagation. I see, that's what I mean. So as you can see here, in the map, you have colored in black, the cities where first cases of COVID-19 have been reported in the US. So as you can see, all the cities are big cities with international airports because we got through international importations. And then what we observed was a very heterogeneous geographical propagation. There is color code in blue. And so that represents the time of arrivals when first 10 cases have been reported in each county. And it's heterogeneous, as always it's for emerging disease. That's a well-known process. And what we really want to understand is which type of mobility, which scale the mobility impacted this heterogeneous diffusion. And that's why it's relevant to understand the scale of mobility is important, because if we know the scale of mobility that capture the disease dynamics, we're also able to design interventions, mobility intervention to control the disease diffusion at the proper geographical scale. So optimize and target control policies. That's something that Brennan also thought about it, in Mexico. And also as a second aspect, it's important to know the mobility scale to design model that are more reliable and make better job to predict the geographical diffusion. So that's the data that we use to capture the mobility across the US. As I told you, it's data from SafeGraph. There are daily scale, so daily mobility data. The space resolution is US county. And what we did was we create we define mobility considering the probability of residents of a county X, visiting a county epsilon. Let's call this, I call this coupling probability, and it's let's say a metric that helps us to define the probability of geographical diffusion. So the probability that the epidemic can travel from one county to another county. And so this is here, as you can see, it's the network created that we call the global the inter-county connectivity network. That of course is short range, like very connected locations, and then like you have like strong connection between big cities and like fewer connections like otherwise. So as a first step, we analyze the network, trying to understand the main characteristics, and as a step, we use the network to inform a model and predict the geographical diffusion. So let's look the network analysis. That's something that like many other researchers did, there's nothing new on this plot, but like each show, like we look at the persistent probability of the links. So the number of links in the network in 2020 compared with the links in the 2019 before the pandemic. And the number of links that was quite stable, except for April, that was when most of the lockdown in the US have been implemented. So as you can see, you see the drop in the links and then like came back to like to baseline. But the most interesting aspect that when we look at the distribution of the weights of the network, we didn't see any change looking like at the month-to-month network. So like overall, like the connectivity network did not change. And from an epidemiological perspective, modeling perspective, if you want to describe the disease geographical diffusion, that's what you care about. You care about the distribution of like your coupling probabilities, because they are the ones that drive the spread. So the second step, we say, okay, it's not changing over time. Let's see what happens like on a geographical scale. So we compute some monthly clusters of based on our mobility. On top, you see that's the administrative repartition in the US. So the boundaries like county, states, and HHS regions at 3 different levels. And then what we use, from our mobility network, we compute the clusters using like InfoMap. And what we found was like, first, that like clusters look stable across time. So month by month, there is not a big difference in the clusters, neither in April 2020 when the lockdown had been implemented. And then as a second aspect, we also found that like a quite good overlap with states, suggesting that states was like a great scale for mobility, and most of contact between individuals happen of people living in the same states. So like these two key aspects in mind, we develop geographical disease modeling to integrate mobility and then look at the disease dynamic. In this case, the compartmental model describing the disease dynamics is a bit easier than the one that we saw before, because we want to see like it's a different scale. We are not looking like locally, but like more like nationally. So we didn't need all these compartments because we are more focused on the invasion. And so it's a simple SEI model where the dynamics is modeled through a metapopulation structure. Like most of you are more familiar than me, like how what the metapopulation structure is, but basically we have like a population that is divided in sublocations, and let's consider that sublocations like could be a county, and people between locations can interact and get infected with a probability that is proportional to this Pij that is coming from the connectivity network that we analyzed before. So that's the model, and that's how most of the time that's the mathematical framework that we use when we want to study geographical disease dynamic and we want to integrate like mobility data to study the geographical disease dynamics. What we want to capture is this mechanism. As we have already discussed before, is the time of arrivals in each county. So we want a model that is able, if we say, okay, the epidemics started in these main cities, the one in black, I want a model that is able to capture like the time of arrival in any other countries in the US. So let's see if like this model like depends on the mobility. And just a quick overview on the mathematical framework of the model. So lambda is the force of infection, it's the probability that like susceptible people can interact with infected and get infected. And this force of infection, it depends on three terms because it needs to account for three different aspects. One is, let's say I am a susceptible individual in a patch high, and I can get infected by someone in the same patch not moving. And that's the first term. Second, I can get infected by some visitors living in other places. And that's like the second term. And then third term, I can get infected by people living in the same patch, but like going somewhere else for work, school, whatever. Get infected there, then come back and infect me. So this is the three aspects that we consider in the model, and they are like captured by the mobility network. But of course, like as we saw from the previous work, I'm also like obsessed with underreporting. So like we try to compute the underreporting in the US as well. And what we found in the US context, we use the number of deaths, the daily number of deaths, and compared with the case to compute the underreporting. For instance, this is in July 2020. And as you can see, it's very heterogeneous across the country. So it's very important to be integrated into the model. And it's also, it changed over time. So like the underreporting increase and with the decreasing of cases, and that's something that we already saw like in the other work, and was very relevant to consider when you work with like reported cases. So once that we compute the underreporting, we were able to correct the incidence, observe incidence. So you can see here in the plot, we have like the number of infected cases and the number of infected US counties at the time that we correct, considered for the underreporting. And we were also able to correct the time of arrivals, the observed time of arrivals, to compute like the corrected one. So this is the plot on the right. Yes, oh, sorry, no, yes. On the left is the number of infected US counties, is the one that we use to fit our model, to fit to the temporal scale of the diffusion, and then the time of arrival was the thing that we wanted to predict. And to do that, like we developed a goodness of fit. That's a metric that helps us to understand if our model is doing a great job in capturing the time of arrival. And so as you can see, like from the goodness of fit, we are comparing like the incidence data and the invasion probability from the model. The invasion probability is the probability that a given time t in my model, a county I is reached by the disease. So there are like some infected individual in the county. And so we compare this invasion probability with the actual data on the incidence to understand like the performance of our model. And so we compare the model performance across different scenarios. That's the first thing that we looked. So we, as a first test, always like you have to compare like your model with like a random network, try to understand if like the mobility is really relevant in the diffusion, or like a random network is enough to capture the dynamics. What we observe in the goodness of fit, that like the model in brown, like the two curves in brown, incorporating the mobility network was working better in terms of performance to capture the time of arrivals compared with the random network. So this is a first result, and it means that like the mobility like shaped the geographical diffusion. So mobility was relevant in the in the dynamics. But if you look the performance considering a static mobility network and a real-time mobility network are the same. This is because we didn't see any difference in the in like April 2020 or in the period with like restriction. We didn't observe any difference in the network. The network was stable. And so of course, when you simulate the dynamics, a real-time network or a static network, they produce the same results. So that means that like the localized mobility change, they didn't affect, they didn't delay the spatial invasion. And like so real-time mobility data in this context, differently from the French context, in this case, they were not necessary in the model. And then as a second aspect, we study like the spatial, like the performance of the model at different geographical aggregation. So if the first had a metapopulation structure, like a county level, then we look at like state, HHS region, and clusters. Like our hypothesis when we performed this work was, okay, I bet that the cluster is the one that outperforms the simulation because it's based on mobility, and like it's telling that people in the same states are the ones that are like more likely to interact between each other. But then when we looked at the results, we look at the goodness of fit, actually the county was still the one that was better reproducing the geographical dynamics. Meaning that like all the other repartition, there are like a low resolution to capture the heterogeneity that were like, for instance, like within states, they were like key in the geographical spread. So that's really meaningful from a point of view that like really like the geographical scale of what we consider mobility and how we integrate mobility into a model, it matters. So we always need to think like how we define our like meta-population structure in terms of like the performance that we want in our model. And that's like the last slide that I wanted just to give an overview of something new that like we are working on it, like with Andrew. And this is like from COVID, like we moved like to influenza, and what we observe with influenza is that the geographical disease dynamics in the US is always start from the south. Like, so that's a very interesting like geographical aspect that was we are not really still able to characterize. So our hypotheses are that this propagation is driven mainly by the inter-county connectivity, the international importation, of course, from the southern hemisphere, the like experience like the influenza peak like earlier, like in summer, and also like indoor seasonality. So different behavior in time of that people spend indoor compared outdoor, because like in the US you have different climate zone that like affect so the disease dynamics. So now we are working with like the same mobility network, the same model, trying to capture like the geographical diffusion from of like the influenza and like in the seasonal aspect on that. So with this, like I promise I conclude my talk. Like we are like, yes, 50, so perfect time. I just listed some discussion points to like help us like keep thinking about how mobility data are really fundamental for like model design and policy making, and how we need to integrate it into model, and how we need to couple mobility data with other sources of behavioral data to better perform our like model predictions. Thank you.
Questions, let's start in person, and then there's folks online with questions you can ask them. Your questions.
So I have two questions. Do you think if we go from county level to city or city level, to the results which you hold, would you be able to say that real high resolution, real time data will go with it?
Do you mean like higher resolution?
Yeah.
Yeah, even for, okay, okay. So some counties are just one city, some others that's true, they are way bigger, so you have very heterogeneity in the like the area, the size of the counties. And yes, let's say that from a public health perspective, county is the lowest scale that you can get from like epidemiological data that you have. It's very, very hard to have data that are like almost impossible to get data specifically on that. That are like lower resolution. And so that's the reason why we like we consider county level as like the bottom of like the resolution that you can get. And but there is like we are like thinking about that. So we are like really like trying to get like a connectivity network that is more like higher resolution, point of interest resolution, that SafeGraph has information, and try to see the network structure. Because I would like very curious to see if like we keep seeing a stability in the network or we don't.
Second question was you said you use another more like a random network.
Mm-hmm. The random network, this is a homogeneous random, like because like you can test like also like other different approach. Like what we did here, we had like all our counties, and we like homogenize the all the contact, because in the mobility network you have like heterogeneous distribution of the connections. So we create like an homogeneous distribution, and each connection has the same weight.
Do you think results will change
That was something that like we are thinking for the review indeed, like to add that in because there was another work in which I used a gravity model network to simulate the goodness of it, and I indeed observed that the gravity model was producing the same results of the mobility, the real mobility network. And so the conclusion of that say, okay, but if the gravity is enough to reproduce like the connections, I don't need mobility data. So that's something that we want to test for the US as well, because that's what we found for Senegal, for instance. That is just the at the end, like the gravity model is enough, because it's capturing like the key aspect that like drive the diffusion.
Really cool. So one for the influenza project that you mentioned, we're actually doing something in Bansal Lab, the global state.
Oh, wow. Yes.
Two, for the, sorry, back to the other side. How did you initialize the model, like the initial conditions for seeding?
The initial condition is here. Like we accounted for all like the counties that had reported cases before March 15th. So that's our seeding events, like the county colored like in black, and then we simulate all the other counties are considered with 0 cases, and we simulate through a metapopulation dynamics.
With like the under-reporting, right?
Exactly. Yes, the seeding account for the underreporting and the time of arrivals as well.
Yeah, just a quick one about, again, the counties performing better than the fourth grade. Is that a sense that there's more fine-grained data in counties than in these clusters? You have a better intuition for why that's happening?
Why the counties, the why?
Yeah, why that's better. Is it more parameters? Just more data?
Yes, it's finer resolution. So it means like this, the model, like the simulation of the model, just to clarify, because I didn't mention, it's always at county level. Because if you want to compare like simulation across different like models, you need to keep the county resolution. So, but what we changed to study the different scenarios is the network. So we create homogeneous mixing at like state level, HHS region and cluster level. So the point that like US counting is working better, it means that, for instance, let's focus on state. In the state scenario, like all like my mobility network within a state is randomized. So if I randomize my connectivity within the state and like and the performance of the model is worse, it means that this connection within the states, they matter, are like in the geographical diffusion. So that's the reason why like county like works better. I agree with the aspect that could be something between your county and cluster, like or state repartition that better performs, because that's true that like the let's say the state and county, there is a big difference in the scale, and so that's something that we don't know, and like we want to explore as well.
Can you tell us about the aggregation process? So you had network at the county level, and then you aggregate at state, then aggregate.
Exactly.
So do you see any problem in losing or in having representativity? Like you won't have the representativity at county level. But when you aggregate at state, you might gain some representativity. Like the users that you have and population.
Yeah, no, I see. I don't think that like, I think county level is already enough resolution to have representativity. So I don't think that at this scale is an issue from like using mobility data. And because like you are already like looking like a very I feel like you have representativity problem when you go like more like point of interest type of like resolution. So you need to think more about that. And so like, of course, when you aggregate at state level, you reduce this, like anytime that you go like higher in scale, like you correct any kind of this type of issue. That's true, anyway.
Just real quick to hop to the chat because Esteban Mora was asking a question, but safe graph data representativity is good in urban areas, about 5% of the population, but worse in rural. So, like, did you see any of these effects under overrepresentation?
Yeah, we observe like the point that like let's say we correct for because what we see, you see that like there is a different, it's very heterogeneous the percentage of device like capture like across counties. I don't know if I have like if I have here, let me see. Oh, no, I didn't. Okay, but like in the supplementary information of like this paper that was on medRxiv, there is a figure that like show the heterogeneity in the device capture and how we correct that.
Sticking with the chat for a second, Seth there has a question that says, thanks for the great talk. One question about lambda values, so the 3 terms for the non-moving visitors and residents. How do you distinguish between the first and the third lambda, since in both cases one person is not moving, but in the third term others are going somewhere else and returning? One agent, how can you distinguish these 2 cases that do not have any overlap?
Did you understand? Like, can you repeat the question?
So, how do we distinguish between the first and the third?
Okay, the individual not moving and the returning residents.
Yes, in both cases, one person is not moving, but in the third term, others are going elsewhere and then return. So, one agent.
Yes, okay, maybe it's the notation that is misleading. And so here it seems that like you are accounting 2 times for the same term, but this is actually like here is a J. So like you are accounting for people not moving in J, not in I, but instead the one that you are accounting in the first term. Yeah. So maybe like that's what she was referring to.
Okay, I'll see if there's a response to that. So one question I had, plotted the weights distribution for, and they were all based on top of each other. I'm just curious, like, maybe we'll just be the case that that overlap is enough to suggest that they're the same, but it seems like there's some like really high weighted, you actually forget which figure it was, but it's the weights distribution of the edges in the network. Yeah, this one. And I just don't know how to think about like these really high PIJs, where if you just measure some dissimilarity measure between these distributions, you'll see that they're quite overlapping. It does seem like a lot of the important connections in the network are maybe these rare ones, or some of the outliers, like these super high weight PIJs between comparison counties.
This very high here is actually the diagonal of the matrix.
Oh,
That's the PII. That like I call PIJ is actually the people not moving. So that's what you see. Yes, these terms here.
Okay.
But I agree that like if you look this distribution, that's for a normalized coupling probability. If you look for just the traffic, you can see a difference in the across months.
The actual structure. This is saying that the actual like, structure itself is just dampened but not different.
Exactly.
Any other questions? Yes.
Are you using model by residents?
SafeGraph, like during COVID, just share the data with everyone. Was on their website, public available for everyone. It was not attached to a university in particular. So we download the data from like their website.
There is a data available on weekly level and daily level. That's different by SafeGraph and.
Okay, so maybe like they downloaded, like they aggregated, and then that's nice.